Hi, everyone. This is Tina. Just before I start off the talk, I want to also point out that I'm here today on personal, in a personal capacity as an expert in this topic, and my views do not represent the views of ECDC. But I am very pleased to be here with colleagues from our colleagues Ève and Ève to talk to you about using public health taxonomy as an approach to understanding social media conversations. And why is it important to think about using a taxonomy for social listening? When we actually started this this analysis and started thinking about last year on how to help analyze and sift through the really a large volume of conversations online, we really learned that we need to have an approach that would help us cut through the conversations and save us some time, so that we could focus and that the risk communications colleagues could focus more on priorities and action and not so much on analysis. So this taxonomy that Amy and Ève will present really allows us to preset relevant categories for listening. They're pre-identified, and this makes it easier to then structure the analysis and link it to the response and the mitigation of epidemic risk. This is really important, especially during the response, epidemic response. And of course, such a targeted analytical approach then zeroes in really fast on those conversations that where questions occur, where confusion is, where information voids exist. And then, of course, that saves time and allows then, the team to really focus resources and time on priorities and action and agile action. And how this was done, Amy will explain, and then Ève has some really good examples of how this was used actually practically by her team and group in Canada. So Amy, over to you.
Thank you very much, Tina. So yes, hopefully everybody can see my screen. That would be a really good place to start. So yes, the taxonomy that Media Measurement co-created with the World Health Organization at the beginning of the pandemic in March last year was designed to cut through the vast volumes of digital content being generated on the topic of COVID-19 so that we could focus on content that has public health implications. Between March 2020 and now, Media Measurement has used the taxonomy framework to analyse over 1 billion items of social media content from across the world. And we've probed that data in order to understand what has driven increased online discussion around key topics. Now, that 1 billion represents 3% of the publicly available social media conversation globally on any topic, and it's an average of 3.3 million social media posts a day. So this is a gold mine of unstructured data, accessing citizen questions and concerns that may signal information voids and provide insight into citizens' unconscious or deliberate misinterpretation of facts. With that said, each question and concern can come with different levels of urgency, of response, and different implications for communication strategy. So the analysis based on the taxonomy is designed to allow WHO and its partners to identify and leverage potential opportunities to address information voids or to counter misinformation by focusing on rising topics of concern and the questions that people are asking in the digital space. So the isolation and identification of questions and concerns within millions of social media posts mentioning COVID-19 daily and at a global level comes with its challenges. From time constraints to deliver timely reporting to the implementation of an analysis process that is able to capture nuance and indeed how different aspects of the conversation on the virus are intertwined with other issues. And in order to address these challenges, structure is key. We collect billions of public English and French language social media posts from Twitter, Facebook, blogs, forums, including Reddit and Instagram, through our data aggregation provider using keyword detection. When it comes to data aggregation and proper data analysis, instead of analysing the conversation holistically, we segment the data into 4+1 main conceptual areas that can better speak to public health individuals. So those are the cause, the illness, the treatment, and the interventions. And then the fifth category is what we call information, which is a segment that looks at how civil society discusses information specifically about the virus online, from meta conversations on misinformation, data and statistics, as well as an overview of the key sources or key influencers being discussed. Within each of these taxonomy areas, we track 35 topics through which civil society discusses the virus, including stigma, symptoms, risk to certain individuals, travel, testing, technology, and of course, treatment and vaccines. This first layer of compartmentalization gives us an overview of the most and least popular themes discussed online in conjunction with COVID-19, but also an understanding of topics that are most likely to resurface again and again, even after appropriate communication has been put out, such as how COVID-19 immunity works, asymptomatic transmission, or COVID-19 risks in children and pregnant women. On top of this layer, we also track questions by pairing our keyword detection infrastructure with question syntax detection in French and English to pick up information voids requiring immediate attention. Also, as part of our analysis infrastructure, we can detect fluctuations in emotions expressed in social media conversation on COVID-19. And we do this using keyword detection that picks up occurrences of 6 emotions in particular, which are denial, sadness, anxiety, fear, anger, and acceptance. The taxonomy structure works as a large-scale signal detector. We build and expand our database on a weekly basis whilst trying to keep track of how online interest in the tracked aspects of the COVID-19 pandemic is evolving. Each week we examine a custom-built data dashboard which tells us which topics have gained velocity on a given week, which is to say have increased in the volume of mentions. This focus on velocity, rather than purely volume, allows us to provide WHO with early warning of topics that may be about to become an issue. This horizon scanning enables WHO and partners to take a more strategic and proactive approach to public health communications, particularly with media measurements, insight capabilities targeted towards those topics that have been increasingly discussed by digital active civil society. We have an experienced team of analysts which identify key stories that have engaged users globally, picking up areas of concerns, more frequently asked questions, and contextualizes them in detailed reports that illustrate what the main issue is, which aspects of each theme are engaging users the most, and where in the world the issue is most severe. We complement that base data set from the taxonomy with cross-references from other data sources, including search data, to draw that bigger picture. And finally, we provide evidence of confusion or fertile ground for misinformation that may require a prompt communication response. Even as we began to roll out weekly reporting at a global level at the start of the pandemic, we were already having discussions about how our co-created taxonomy might be useful at a more localized level. We started having conversations with potential partners about how they may be able to use the insight, including WHO Southeast Asia. And those of you who attended day 1 of this conference would have heard Dr. Supriya Besbarua share the work that we do with her, part of which is based on this global taxonomy. We've also run pilot studies for individual countries, delivering insight based on the deep dive analysis of digital conversations in Malaysia, Mali, and the Philippines. We also began working with the public health team in Quebec to provide supporting data and insight to drive public health information interventions at a provincial level. In order to do that for Quebec, we thankfully had designed the methodology to be adaptable from a global scope to a local or hyper-local one. That said, the early stages of the adaptation process were key to ensure that local voices would be heard. To achieve this, there were some questions we needed to answer. What does the social media use landscape look like in my target region? Does our data infrastructure reflect that landscape, or do we need to make adjustments? For example, jointly with the colleagues in Quebec, we powered up our Facebook Insight capabilities because, for example, Twitter was not used as widely in the province. This also called for the creation of additional strategies to adapt social media listening to the lack of Facebook's geolocated data available to the public through the inclusion of toponyms, so place names, in our search strings. Last but not least, the localization of keywords does of course require accurate preliminary research. We powered up our search strings to account for phrases or institutions that are unique to the Quebec context to detect conversations on healthcare. And I'm now really happy to hand over to Ève, who's going to illustrate how the Institute has been taking advantage of our insights.
Thanks. So just a note for those who are less familiar with this context. So Quebec is a French-speaking province within Canada. So that means that most of the English discussion outside of Quebec are not really having traction within Quebec. So Quebec has its own TV show, institution, and we often speak of two solitudes, Quebec and the rest of Canada. Next slide. So the most important use of the intelligence provided by media measurement is, of course, to flag rising false information and to adapt our communication strategy. So I've put you the Quebec website that is able to answer a question about COVID-19 and that is frequently adjusted based on rising topic and areas of concern. The work of media measurement also allowed us very early in the pandemic to understand that we were having one of the world-leading conspiracy theories in French. So a very small number of accounts were generating a lot of false and misleading information. And we also have observed the growth of the popularity of these discourses online using the report from media measurement. And because these groups have a lot of influence offline as well, so they organized protests, they took lawsuits against the government, they harass journalists and public health people, but they also promote a lot of false information about the disease, the measure, and the treatment. So we use intelligence from the report to avoid further contamination by this group, to provide good information for the rest of the public. We know that we won't be able to convince these people to change their mind, but we want to ensure that they don't promote too much false idea to the rest of the public. Next slide. The other very useful information that we get from the taxonomy and the report is an ability to be able to assess current feelings and area of concern within the public. Both the emotion analysis and the discourse provide us way to tackle the level of acceptance of different measures. So a couple of examples to illustrate. Curfew was implemented in Quebec last January to contain the second wave, and Quebec is the only province in Canada with a curfew. There were few exemptions, but none for people who are experiencing homelessness, and this generates a lot of negative discussion online, and it finally was revoked. But the report from media measurement really allow us to understand that the majority of Quebecers were not against the measure if it was implemented with equity. Another example is the lack of strong measure at the borders to control travelers in the context of COVID-19 variant. This was highly criticized on social media. It's interesting for us, not only in terms of the public desire for stronger measure against the pandemic, but also the feeling of pandemic fatigue and the need to blame some group for not responding or respecting the measure, even if in fact the travelers were not generating a lot of outbreaks of COVID. And on a more positive note, we have observed an increase in the level of support for the different measures in Quebec after the many testimonies of healthcare workers who expressed their fatigue and the burden of their work in the context of the second wave. So that is a positive outcome of online conversation. So next slide. Of course, another useful information for us is to inform communication intervention that are on social media. We can assess the acceptability of some of the campaign. Here are two examples of communication intervention that did not went well. Of course, it's always
1 minute left.
Oh, okay. So I'll skip that. Just to conclude on next slide. Just a note on the importance of putting findings of social listening into context. We triangulate the result with the surveys that we're doing, or focus group discussion, to have a good understanding of the current level of acceptance. So our work with media measurement for over a year has shown us how the online discourses are polarized and how the voice of the majority of Quebecers that are not opposed to most public health recommendation is often not represented. But the minority of social media users that are strongly against the measure are generating a lot of misinformation, and it's really important to have access to these misinformation to be able to adapt our strategy. So that's it from my part.